Okay. Our last abstract of this session is entitled Co-designing Interventions to Improve Mental Health Awareness and Recognition for Individuals with Heart Failure and Their Caregivers, a participatory action research approach in the brain-heart dyad, and is presented by Sarisha Phillip.
Hello, everyone. My name is Sarisha Phillip, and I'm a research coordinator with the Center for Care, Access, and Equity Research at the Bruyere Health Research Institute. Today, I'll be sharing our research on improving care for heart failure patients as part of the University of Ottawa's Brain-Heart Interconnectome Research Program. I'll be showing you some of the research we've done, as well as our next steps and how we plan to involve community paramedics as part of our future intervention. So to give a bit of background on the research project, this work started by looking at brain and heart conditions that are interconnected. This means situations where a heart condition impacts brain health, or vice versa, where a brain condition affects your heart health. Just for context, these are some of the leading causes of illness and mortality in Canada. And when we think about brain and heart care, it often ends up being quite fragmented within our healthcare system. So for example, when someone visits their cardiologist, the focus is typically on their cardiovascular health, which means that other aspects such as their diabetes or their mental health or dementia aren't always part of that conversation and assessment. Our study specifically focuses on one interconnected brain-heart condition, and this is heart failure and mental health. In Canada, there are more than 100,000 individuals diagnosed with heart failure each year. And we know that people living with heart failure are at a heightened risk of experiencing mental health challenges such as depression, anxiety, and stress. To tackle these types of issues, our research team utilizes a community-based participatory action research approach. So we work directly with our community members to better understand the gaps in care and to co-create solutions to improve how heart failure and mental health care are delivered within their region. So who are we specifically working with for this project? Our project is guided by a research coalition made up of leadership members and staff members from 2 Ontario health teams in the Eastern Ontario region. We've also have a patient and caregiver partner as part of our coalition, along with primary care providers, a cardiologist, and a psychologist. The Research Coalition really is a guiding body behind the project, shaping the directions, the decisions we make, as well as the outputs. As part of our other research projects, we have frequently and successfully collaborated with many community paramedicine programs in Eastern Ontario and are looking to involve them to help increase primary care capacity and reach for this project as well. So this 3-year project aims to improve care systems for people living with heart failure who are also experiencing or might be at risk for experiencing mental health challenges. Today, I'll briefly touch on some of our results from year 1, specifically our results around asset mapping and our interviews. And then I'll focus a little bit on our year 2 work and what we've achieved and what our next steps are. So for those unfamiliar with the term asset mapping is a method used to identify services and resources that currently exist within a given region. It helps us understand both the strengths and gaps within a care system and service landscape. In our case, we focused on identifying services available to people living with heart failure who may be experiencing mental health challenges. Together with our research coalition, we identified 6 categories of resources and services that they were most interested in exploring through asset mapping. Examples included looking at nutritional services, cessation programs, exercise programs, as they have an impact on heart failure care, management, and prevention. Through this, we developed a categorized list of resources under each area. So here's an example of one of the asset maps we created. This one focuses on healthy lifestyle supports. So as you can see, we mapped out the different types of services that exist within a region under each of these categories. These asset maps also set us up directly for the next phase of our project, which involves speaking directly with patients and caregivers experiencing heart failure. This helped us understand whether they were aware of services, whether they use these services, and what their experience was. So this is just one example. We created multiple types of asset maps. And one of the things we're working on in year 2 that's directly related to these asset maps is making them public facing. So we heard from our coalition as well as from the people we interviewed that they would like to have access to this type of information so they're more well versed on what exists within their community. The second stage of the project involves community consultation. So this involves speaking to patients, caregivers, care providers, and service providers to better understand their experiences. So we ask questions such as, do you see as heart failure and mental health as interconnected? What has your experience been accessing clinical and community-based services? And through this process, we interviewed about 19 patients and caregivers, as well as 8 care providers and 4 service providers. We then analyzed the interviews following a thematic analysis approach. I won't share all the interview results for the sake of time, but one of the themes that came out from the data was that some patients strongly acknowledged that mental health aspect as part of their condition. So things like experiencing anxiety, fear, emotional stress. But on the other hand, there were patients who didn't see mental health as linked or a major concern. For them, it was just something associated with that initial diagnosis and related to shock, but they eventually described getting over it and moving on. In terms of the second theme that came up, it was around access and quality of services in a suburban and rural setting. So patients talked about difficulties in accessing services when you're living outside of an urban center like Ottawa and having to deal with longer wait times, limited availability, or significant drive times just to get care. And then finally, patients and caregivers talked a lot about self-management. So many patients describe preferring to manage the condition on their own by doing things such as creating their own exercise routine or adjusting their own diet or keeping track of their own symptoms. So now I'd like to transition a little to year 2. Right now we are in the co-designing phase of our intervention with our coalition. Based on the findings from both the community consultation as well as the scoping review we conducted, the intervention that we chose is one that aims to improve mental health awareness, recognition, discussion, and overall management in this patient population. So the intervention we're developing will have 3 versions. One is targeted at patients, one targeted at caregivers, and one targeted to healthcare providers. Some of the core components that are being shaped right now are things such as creating educational material to improve awareness and recognition, discussion support, so supporting care providers and having and navigating these conversations around mental health with their patients. And then we have those asset and activity maps, which are related to learning about different resources, as well as self-management strategies and so on. Because I have a healthcare provider audience here today, I'd actually like to take a moment to share one of the tools we're prototyping and refining. It's our information conversational support tool. And this is aimed to support care providers in learning more about the interconnection of heart failure and mental health, as well as navigating these conversations with patients and caregivers. So to give you an example, this is one of the conversational prompts in our tool, and we've kept the language intentionally neutral as this is from direct feedback from our patient and caregiver partners. As you might not be surprised to know, not everyone is comfortable talking about mental health. So we've phrased the language around quality of life, energy levels, motivation, and things like that. Based on how the patient responds, there are different dialogue boxes related to how the care provider can then navigate that conversation. This tool would then link to the patient and caregiver educational and resource tool we're developing, which is a web-based tool where patients and caregivers can learn more about heart failure and mental health and how to manage the symptoms and when and where to seek support. To give you a rough idea of what are some of the things in this tool, we've developed some early drafts of testimonials that will be part of the tool. There's also information about each mental health challenge, so stress, anxiety, and depression, and how to self-manage and how to recognize when it might be an issue. From here, we move on. I want to talk a little bit about that intervention and evaluation phase. Our goal is to pilot this intervention in 3 settings across our 2 HT regions. Our 3 settings are team-based primary care, cardiac specialist settings, and an emergency discharge. We've chose 3 settings as we want to try to reach these patients at different care points and time points during their journey. And then we are also hoping to leverage different types of care providers, so nurses, community paramedics, and allied health professionals. And to bring that back to community paramedics, our previous research has also already shown this, and you're probably already aware, but there's a huge potential in leveraging community paramedics in these types of interventions. They can really help expand primary care capacity, help us reach vulnerable and higher risk patients, especially those that live in rural settings where there might be less services. We've also found through our research that community paramedics are really well versed in what resources are available to help support patients and caregivers. So with that, I just want to end off to say that we are looking for more partnerships with community paramedicine programs. So if anything I said is of interest and you want to learn more, please reach out. And other than that, thank you so much for your time and attention.
Thanks for that. And we have Sarisha here with us to hopefully answer any questions. And we've already got a couple in the chat. So I can see yet more opportunity for community paramedics as it seems to be ever evolving. So welcome. The first question we've got is kind of a two-pronged question. So did the interviews identify any heart failure gaps in care or community resources? And the second portion is, how do heart failure patients differ from diabetes and other chronic illness patients that in receiving these supports will lead to better outcomes as compared to other chronic illness groups?
Yeah, those are great questions. So I think for the first one of the things we actually learned from the interviews is I showed in the presentations that we created these asset maps, and we were presenting these asset maps in the interviews to ask them about their experience either accessing, using these services, or awareness. And what we found is that a lot of people weren't aware of the services that existed in their community. And there was also partly a bit of a resistance towards using certain services. So that self-management theme came up as like, oh, this is something I can handle on my own. I found ways to kind of tackle this. I think part of when we went into the intervention co-design was trying to talk about, okay, let's support self-management, but also talk about the importance of using certain resources as a preventative measure. Because when we're talking about mental health, we're both trying to take the preventative approach as well as those currently facing those challenges. So it did help guide us in being like, okay, let's support self-management, and then let's also give you a resource that lets you figure out what exists in your communities, and then what are the goals of those resources, and how would they help you manage your heart failure or mental health. And then in terms of the why heart failure and mental health, so I totally agree with you. I think a lot of the things we're creating could apply to a lot of people with multiple chronic conditions, whether that's diabetes, COPD, and things like that. And I think that's overall the goal with the project, because as you probably know, people with heart failure are likely also having other conditions that are impacting their health. It's just like for the purposes of this project, we're funded by the University of Ottawa's Brain Heart Interconnectome. So it's really, in that case, looking at conditions that are brain and heart related. But I think our goal with our tools and what we're creating is that we can then spread and scale what we've learned to other conditions. So that's definitely something of a consideration on our end.
Yeah, no, this is a great place to start. So that's excellent. We do have more questions kind of filtering in here. So the next one is, would increasing the awareness of these community programs overburden them?
Yeah, so we get that a lot. So the mental health thing comes up a lot. So are you asking people to get or go use mental health services where they're waiting 6 months to a year to access these services because it's so overwhelmed? I think that's one of the big reasons that we are trying to create self-management tools too. So potentially maybe while you're waiting for services, what can you do to support your own health and support both your heart failure and your mental health? And I also think that's trying to bring mental health into other pieces of that conversation. So talking about the importance of physical exercise, that's both good for your heart health and your mental health and things like that. And also support groups, like there was, for the people that we interviewed that were part of heart failure support groups, they found a lot of benefits in that. But then for the people who weren't, trying to deal with maybe either their resistance towards it or the stigma towards it. So showing what other kinds of ways you can treat your mental health that's not necessarily using a mental health services, but then also making sure that we have options for people who want to access mental health services. Hopefully that answers what they were asking.
I think it does. How do we, the next question comes from an anonymous attendee. How do we as paramedics utilize this information to help support patients and caregivers?
Yeah, so that's the part of our intervention has exactly like a tool that is really about having the providers be that touch point. So the idea that some of these patients aren't aware about that interconnected issue. And so one of the reasons we created that informational conversational support guide was that we found that the treating the whole patient kept being pushed to different sectors. So the cardiologist doesn't want to talk to you about your mental health. The emergency department has different ideas. So the goal is trying to say, like, because of our health system, where the patient ends up can be very different. And we're trying to build capacity for different providers to kind of bring that interconnected piece into that conversation and assessment. And the goal is to support providers in having those conversations, but then giving them this tool that we're creating so that the patient can then spend time looking at these resources on their own. And so part of the piloting will also be trying to find like a good way to make sure that whatever we create is like feasible for the different providers we work with and works with their workflow, and also hopefully helps the patient and is more person-centered and the
Good.
caregivers. Yeah.
Another question here we have is, how do you envision the collaboration with community paramedics? What role is it that they would serve?
Yeah, so we've worked with community paramedics a lot. So one of the things that we think is really, so with the tool that we're creating for care providers, it's very hard to ask physicians to use the tool or add another task because they're very overburdened and they're not interested. So when we talk about primary care, we are talking about leveraging other forms of primary care. And I think community paramedicine is like this growing field that is really something that is exciting and is definitely a team and a type of service that we're really interested in looking at. Partly because community paramedics typically are doing home visits, so they're reaching patients that may not be able to go to the clinic. They're better at reaching patients in rural settings where there are less services. So I think, and then we also found out that they're really well versed in what exists in their community. So I think there's a lot about having and leveraging community paramedics to be part of this intervention and to see how that works in a maybe more vulnerable, hard to reach population group. And yeah, because we might not be able to reach everyone who's coming and able to go to a clinic setting.
Yeah, I would agree. Okay, thanks. That's all we have for questions. We just have one request from one of the attendees to reach out, if you wouldn't mind answering him in the Q&A. And thanks for your presentation. It was great.
Great, thank you.